A ransomware attack has thrown Frederick Health Hospital into chaos. On January 27th, hackers infiltrated the hospital's IT systems, forcing administrators to shut down servers and revert to paper-based operations. While emergency rooms remain open, critical services like lab testing are halted. Ambulances were briefly diverted, and patient data hangs in the balance. This video is sponsored by Stonefly. More on that at the end of the video. The hospital confirmed the attack after third-party experts identified ransomware as the culprit. But with systems still offline and leaders tight-lipped, patients and staff are left grappling with uncertainty. Most departments are operational, but the Frederick Health Village lab remains closed. Emergency services are now accepting walk-ins and ambulance arrivals, but the hospital's electronic systems, including prescription refills and patient portals, are frozen. Staff are relying on manual downtime procedures, requiring patients to bring physical medical records to appointments. The ripple effect is spreading. Meritus Medical Center, a neighboring hospital, reports a surge in ER visits as Frederick Health struggles to regain control. Meanwhile, cybersecurity and law enforcement teams work behind the scenes to restore systems and investigate the breach. The hospital has yet to confirm if patient data was stolen, but experts warn that ransomware gangs often exfiltrate sensitive information before encrypting systems. If personal data, like medical records or social security numbers, was compromised, patients could face identity theft risks for years. Frederick Health promises to notify affected individuals in accordance with the law, but with no timeline for resolution, frustration is mounting. CEO Tom Kleinhansel has avoided media interviews, and spokesperson Josh Faust declined to answer key questions about the investigation, system restoration, or employee impacts. Critical gaps remain in this story. Which law enforcement agency is leading the investigation? When will systems be fully restored? Can staff access digital patient records, or are they working blind? Have employees faced pay cuts or reduced hours due to the outage? The hospital's silence has left patients, staff, and the public in the dark. A troubling pattern as healthcare becomes a prime target for cybercriminals. Ransomware attacks on hospitals are no longer hypothetical. They're life-or-death crises. Frederick Health's ordeal exposes the fragility of healthcare infrastructure and the human cost of cybercrime. While the hospital vows to emerge more resilient than ever, the immediate priority is restoring care and trust in a community on edge. For now, the message to patients is clear. Keep your appointments, bring your paperwork, and brace for delays. But for hospitals everywhere, the lesson is sharper. Prepare or become the next victim. And now, a word from our sponsor. 200 terabytes. Veeam, Rubrik, Commvault, immutable and air-gapped backup, and disaster recovery appliance for $14,995. Contact sales at stonefly.com for detail. Subscribe for more cybersecurity news.